The mommy makeover surgery. You know, children are some of the most amazing miracles I think we get to experience. My wife and I, Katie, are very blessed to have two little girls, Annalie and Fiona. But as those wonderful miracles are coming about, a woman's body goes through many changes. And I talk with mothers every day that are very frustrated that, you know, many years have passed since they've had children, and despite strict dieting and exercise, they just can't get back to looking the way they did before children. Specifically, there's some areas that are affected that can be addressed: the breast, the abdomen, the hips. And that's what makes the mommy makeover surgery possible, to affect all these areas. First, the breast. As a woman's pregnant, breasts go through many changes. They change in size as the milk comes in to cause them to be engorged. And the milk goes in and goes out, and the breasts are stretched and expanded and decompressed. And that causes the tissue around the breast to lose some elasticity and some of the volume of the breast in the upper pole. And so after pregnancy and after the nursing process is complete, it appears the breast may have changed in size, but in reality, very little. But however, the tissue around the breast, the skin, has changed and can't restore its pre-appearance. So in order to address this, there are different maneuvers. First, an implant can be placed in the breast and to allow some restoration of the upper part of the breast. But many times, in order to address the skin around the breast, a mastopexy or breast lift has to be performed. And this can cause to provide that tighter, uplifted appearance of the breast that was there before children and is not there anymore. Many times, I'd say most of the time, combining an implant to restore that volume in the upper breast along with a mastopexy can give the best result. Now, the next area, really the abdominal area, is absolutely affected by pregnancy and afterwards. There's many weight changes, and there's really a rapid increase in weight as the baby's developing in the mother's womb. And afterwards, the weight is lost, but the skin and the soft tissue have lost their integrity again. And so an abdominoplasty or tummy tuck addresses these issues. And there's really two main parts. One being removing the tissue in the lower abdominal area that just will not return its form otherwise. And second, during pregnancy, the muscles in the abdominal area are spread apart. And so that's what allows the abdomen to have enough room for the baby. And so those muscles, they can't return back to their original position without being corrected by surgery. And a tummy tuck or an abdominoplasty corrects both of these issues. Next, I find that during pregnancy, fat deposits can develop, particularly in the hip areas and the lower back, and they're very stubborn. They won't go away despite, again, exercise and dieting. Liposuction is an excellent tool that can help remove these deposits, and you won't have to deal with them anymore. And so that's what brings us to the mommy makeover surgery, is that all of these procedures, the breast, the abdomen, and the liposuction, may not be needed all for every mother, but they can all be combined safely into one operation. Again, specific goals and needs for each woman need to be evaluated thoroughly before developing that unique plan. But the important thing is that all of these surgeries can be performed in one safe operation. And that way, a mother doesn't have to go through multiple surgeries and multiple recoveries, because I know that mothers can be very busy with children and they can't take the time to separate all those out. And so that's what I think the great thing about a mommy makeover is it can be combined and be done all at once. And so what I would tell a mother is, if she's gone through some of these same thoughts that I've discussed and can agree with some of the things I've described, the next best step is to have a consultation, and that being a board certified plastic surgeon, mommy makeover surgeries are procedures that I do very regularly. And so I would recommend discussing concerns and goals with a board certified plastic surgeon such as myself. I'm Dr. John McFate here at Precision Plastic Surgery, and I look forward to meeting you soon.
For your appointment, contact our office today and see why precision is not just a word, but our culture at Precision Plastic Surgery.